Yes, welcome to the chat, my friends, where you will be watching from, every place you will be. Talk about questions concerning epilepsy, some questions that arise when people hear about epilepsy. There are several questions that people hear about epilepsy. That we need to talk about. I am Josh. Greetings. I am Josh. Which remind me which place you come from. You told me you need some help. I don't know if it is confidential or if it is classified or it is we can just talk. I am Josh is here. I am Josh. Welcome to the chat. Welcome to the platform. Welcome to the platform. There is something you asked about. You want to talk about something. Maybe it is classified or it is confidential. You can tell me. But if we can just talk, it's okay. We can talk. Welcome to the platform. I'm just getting in to talk about some questions about epilepsy. Some questions about epilepsy. Epilepsy has too many myths. Epilepsy have too many myths. Remind me, I am Josh. Where in Kenya do you stay? We are going to talk about common myths and frequent asked questions about epilepsy. Common questions about epilepsy. Those are the things that we're going to talk tonight. So welcome as everyone is coming in. Let's talk. Let's talk to the people. Let's invite everyone. Let's see. Migori County. Oh, Migori. Migori is in Nyanza. Migori, Nyanza, Kisii, Migori, Kisii, all those places. So all that you're coming in right now, welcome to the chat. Welcome to the. We had talked about epilepsy. If you are a new person, join I am Josh at the chat. Yeah, join I am Josh at the chat. If you are new to the platform, I welcome you to Benjamin the Wise Guy channel. And if you are new and you're watching me, please subscribe. This is a medical channel. We talk very many things about medical issues and mental health too. Josh, welcome to the platform. Don't go without telling me hi at the chat. Chat, tell me where you are watching from. Tell us where you are watching from and interact with us at the chat. Just text something, tell us hi. I come from this continent and I am here. So interaction is a good thing. If you're coming from US, if you're coming from the Asian countries, if you're coming from African countries include Kenya, Angola, Zimbabwe, South Africa, everyone around the world, around the globe that you are watching me, welcome to the chat. Don't just go without hitting the like button. Don't go without hitting the like button, and don't go without leaving your subscription. Subscribe to the channel. Let's see what we have today. Today we were talking about epilepsy. Epilepsy is a condition that so many people have talked about around the globe. So many people have discussed about epilepsy in a funny way. It has got myths, it has got several questions, and that is what we want to answer today. We were talking about it and we answered some questions, but at this time of the night, what we usually do is we answer questions concerning the topics that we have always been talking about. So you who is watching, wherever you are, who is there watching, tell me where you are chilling from, where you are chilling at. Tell me where you are watching me from. Interact with the people that are in the chat. Give me your like. Subscribe to the channel. Your subscription is supporting the channel, and also watching something is supporting the channel. And as you support the channel, you are learning. You see, it's a channel whereby when you subscribe, you hit the like button, you are supporting the channel while you are learning something. You just don't go like that. And if you have any medical question, don't fail to ask. Just come to the chat, ask. I have this problem. I had this problem. Benjamin and the church. How can we talk about it? Let's see who is new in the channel. Hit the like button and tell us if you are new to the channel. Now, today we want to talk about common myths and frequent asked questions about epilepsy. You know, epilepsy has several myths, and people talk about very many things. Like someone can tell you that epilepsy is a mental illness. Hmm? There is a difference between, many people say that epilepsy is a mental illness. Mental illness, you understand, mostly mental illness are issues concerning the brain, cognitive functions of the brain. Welcome, you new guys, you new person that you are watching. Don't go without giving a subscription. Hit the like button and subscribe. Subscribe to the channel. Ask me a question and tell me where you're coming from. Tell me where you are watching from. Where are you watching me from? Let's interact, my new guys, my new friends. Let's interact at the chat. Now, epilepsy is a common myths about epilepsy. One thing I've said, many people have said epilepsy is a mental illness. Hmm? The myth, something that is not correct is myths. Some things that have been said but are not correct. Some things that have been said that are not correct. So if you are, I'm Josh. Hope you are around. Hope you are around. I am Josh. You keep interacting with the new guys on the market. On the market. I'll be back soon as we talk about Yes, I am back. I'm back. Those that are watching, thanks for coming in. Sometimes you are at work and you have to work this side and you have to work this side. So thank you for understanding and being there every time. If you have any question, please just ask about the question that you want. Just ask about the question that you want, and we have talked about epilepsy is a mental illness. Some people say epilepsy is a mental illness. Now, is really epilepsy a mental illness or a neurological disorder? Those are two different things. Epilepsy is the myth. What is not true says what is not true now. If you are watching me, let's interact at the chat, and let's have some questions rolling, even if I'm just coming in right now. Let's have some questions rolling. The myth is epilepsy is a neurological disorder caused by abnormal electricity in the brain. Some people with epilepsy may not also experience anxiety or depression, but epilepsy itself is not a psychiatric illness. Let's get to the other thing. That one is very fine. Is epilepsy a neurological development disorder? Myths. Is epilepsy a neurological disorder like autism? Someone may ask, is epilepsy and autism? Epilepsy is a physical condition that attacks someone. Let me see this. Okay, welcome. If you are watching, we have been talking about epilepsy, and we are dealing with some questions that are always asked about epilepsy. So epilepsy, is a neurological disorder, meaning it affects brain and nervous system. That is not a myth. That is a true thing. It is not mental illness. It is not a psychiatric illness. Mental illness is a psychiatric illness, is an illness that affects the cognitive function. But this one, epilepsy, is a neurologic disorder that your brain has some problems in abnormal electric signaling. This is about epilepsy. So don't tell anyone one day that epilepsy is a mental illness. Epilepsy is not a mental illness. Epilepsy is not a mental illness. It is a neurologic disorder. Neurologic. When we talk about neuro, we are talking about the brain and the nervous system. The brain and the nervous system. You check it. Check on that. Now, there are some things that we need. And if you have heard about any myth, I know there are several myths there are so many myths in the society concerning epilepsy. That is what we want to talk about. We want to talk about things that people talk about and they are not true. Things that people talk about and you yourself are not true, because when you do some talks about epilepsy, some talks about let me check out this. Yes, that one. When you go to talk about some things in epilepsy, people tell you things that even don't add up. Some issues that even don't add up until you start laughing for yourself. Now, epilepsy is a neurologic problem, physical. When we are talking about neurologic problem, we are talking about physical problem that is affecting the brain, not a psychiatric, not a cognitive. Cognitive affects how a person thinks, feels, and behaves. How a person feels, thinks, and behaves. That is cognitive functions. Cognitive functions. But now, epilepsy is a physical problem. This is a problem that affects the brain, electric function of the brain. So let's get out of the myth now, and be factual about epilepsy. Welcome, my guys. I can see you are coming in, and you are not telling us where you are from. If you are coming in right now, please come to the chat. Tell us where you are watching from. Tell us where you are watching this from. Tell us where the chat is getting you, the video is getting you from. This is Benjamin the Wise Guy, Dr. Benjamin, bringing you facts about epilepsy. The facts about epilepsy. Yes, don't just watch. Subscribe so that you can get instant. Subscribe so that you can get instant messages, activation messages, or the messages you get when they tell you Benjamin the Wise Guy is live. Subscribe to my channel. It's a good channel. You'll meet good people here. And double tap your screen if you are using the phone. Like the stream. Now, people with epilepsy are possessed or cursed. But that one nowadays, people are over that. No one can say that a person with epilepsy is cursed, or we are over that. The life we are living right now, we are over saying someone is cursed because this person has epilepsy and behaves in a certain way. No, over that. Continue liking, my friends. Like the video. Videos give us impressions. Video gives us impressions so that more people can come and know we are talking. And if you have any question about epilepsy, don't fail to ask. The chat is open. Go to the chat and click. So that we can interact and get to know how things happen when a person has epilepsy. Now, people with epilepsy are cursed. No, this is an old cultural myth. Epilepsy is a medical condition. Scientifically caused. It is causing such as brain injury, genetic factors, stroke, infections, tumors, fever-related seizures in children. You see, it is not caused by a spirit, witchcraft, or curses. We understand that when we started talking about Soli. Didi Jack Tahi. Did Jack is a drunk. Soli, which country are you coming from? Are you from India? Soli, I feel like you are coming from India. Or which state are you coming from? Welcome to the chat. Alizwa Didi Jack Mtai. I don't understand that. I understand English, Swahili, and maybe those two. Maybe a little of French. Yeah. So welcome to the chat, everyone. If you are watching, let's talk about what is called. Let's talk about epilepsy. Epilepsy is a genetic disorder that people have really I'm reading some texts that are popping out that really people have really confused. So if you are here and you are a new person, hit the like button. Like. Let's talk about epilepsy. Come to the chat. Let's talk about epilepsy and several things that affect some people. Now, that one is an old thing. We have seen that epilepsy is brought by brain injury, genetic factors, stroke, infections, tumors, fever-related seizures in children can destroy your brain until you start having epileptic episodes. So if you have a question and you are here, if you have a question about epilepsy, don't fail to answer, my friends. To ask, my friends. Come on, ask. ask that question. Let's interact. You see, let's interact. Ask those questions and let's interact. Now, you should put a spoon or wallet on the or object on the mouth during a seizure. When a person is having a seizure, some people may say that put something on the mouth so that this person cannot bite the tongue. It is very dangerous, my friends. And when we talked about it, you saw it is very dangerous to put a stick or something in the mouth when someone is having a seizure. It is dangerous. And why is it dangerous? It can break a tooth, block breathing, cause choking, injure the jaw. And when you injure the jaw, you know, when the convulsions are too high, you can break even your jaw. That is another traumatic event that's happening. So a person cannot swallow their tongue. There is a lady who came to a hospital and the person that she brought was convulsing. And this lady was so worried that, doc, you know, he can swallow the tongue. Let's put something so that this person cannot swallow the tongue. And we were like explaining to this person that it is dangerous to put something. It was so hard. But we took the person to an emergency place and we managed until the seizures were down. So a person cannot swallow a tongue when he is having an epileptic condition. So don't put anything on the tongue, on the mouth, to avoid this person from convulsions. That is a myth, and we don't want to deal with myths. We don't want to deal with myths. Epilepsy is contagious. Imagine someone saying epilepsy is contagious. Contagious meaning if you eat food if you share food with an epileptic person, this person can pass it, like cholera. Like if you touch or you interact with a person who has epilepsy, exchange fluids, you can have epilepsy. Who said so? No, epilepsy is not contagious. Touching, sharing food, saliva, living together, no. Epilepsy is not contagious and will never be contagious. Interact with those people. It's a neurodevelopment disorder from the brain, releasing abnormal electric effect on the brain. So interact with these people. Be friendly with them. Encourage them to be taking their medication. You see, greetings, Leila. Leila, I see you. I see you, girl. I see you, girl. You know, you call yourself girls. I see you, girl. I have my friend, the ladies that say we are going. Us girls, we are going for us girls. We are going for lunch, and when I had to reduce. Wow, shaved. Shirt Raffles told me I look good when I'm shaved. So everyone is telling me that thing. Hey, doc, today you have really shaved. People are used to me with big beards. Yes, welcome, Leila. We are talking about questions concerning epilepsy. Questions concerning epilepsy. And I've reached somewhere that I'm talking about a question that I was sent about epilepsy being contagious. You know, contagious means you can pass it through food, through kissing, through saliva, exchanging fluids. No, it is not. It is a neurodevelopment disorder. A neurodevelopment disorder is a disorder. I lost a classmate this year about epilepsy. Yes, epilepsy, you can, that is very important. You know, Leila, it is called neurodevelopment disorder. Electric production that are causing your brain to work in a way that it's not needed, producing complicated signals that are not well. So if you have epileptic convulsions that are tonic-clonic and hard, they can injure your brain. And if they injure your brain because they are electric convulsions that are coming so fast, and what you can die, because when your brain dies, you know you have a problem now that cannot be sorted. So it depends, and those people that fall on clonic atonic seizures, atonic means the muscles lose strength. You can hit your head somewhere, and then when you hit your head, you have a problem. Brain injury kills people. That's why even the convulsions can damage your brain. So let's continue. Epilepsy is contagious. No, it's not contagious. That one we have said. It is not contagious. Let's talk about all seizures involves shaking. Even right now, the topic that we are talking about is called absent seizure. Typical and atypical, two types, typical and atypical. Some seizures are subtle. A person may stare blankly, suddenly stop talking, smack lips, become confused briefly. So don't expect every person who has epilepsy or seizures to convulse the normal way people convulse, they fall down. No, this person may be having something that is called blank seizures. Blank seizures is whereby you are just there looking at someone like this, staring at someone like the typical and the typical. You know, typical is a short moment of passing out, but you are just looking at someone. And then when you come back, you start asking people, why are you looking at me like that? They tell you are sleepwalking or you are daydreaming. It is an episode of epilepsy. You see, that is, so let's get to know that not all types of epilepsy someone has seizures. No, not all types of epilepsy is that someone has seizures. Let's talk about people with epilepsy cannot live normal lives. Why? Why do you say so? They go to school, they live normal lives. That is a myth. That is a myth. People with epilepsy live normal life. They go to school, they do work, they marry, they come up with children that are living good life. So let's not talk about these myths. You know, these are, hi guys, Betty in the house. Welcome, Betty. We are talking about epilepsy and myths about epilepsy. These are people that play sports, become doctors, teach others at least. Normal life, you know, they live normal lives. They live normal life. So epilepsy, a person is not different from the others. It's just a condition of the brain that is having him an attack at a specific moment. But everything, the cognitive function, how you behave, character and interaction is there. It does not affect cognitive functions. You know, cognitive functions affect how you behave, how you talk, how you interact. Yes? So check out my guys. When you're coming in, I see people coming in. Ask your questions about epilepsy. Interact with me. Hit the like button, and if you are new, always subscribe to the channel. Now, let's talk about something that is called epilepsy and period. Epilepsy and period. People may say that epilepsy always lasts forever. If you have it, you will never get healed. No, it is a brain neurological disorder of electrical function. So as you grow, you can overgrow it. Some children have grown bigger on medication, and at the age of 12, 13, 14, going to 20, they have outgrown it. And some people have become seizure-free without the epilepsy itself. You see. So epilepsy is not, you cannot, some people have outgrown it. So if someone is having epilepsy, don't say that they will continue having it forever. No. They will not. You should hold a person down during a seizure. When someone starts to have tonic-clonic seizures, the ones that are aggressive, some people hold that person down, forcing this person to be calm. No. Leave that person. You can position that person to be in recovery position. I explained about recovery position at one time. Pew Pew said hi. Pew Pew 6767. Welcome, Pew Pew. Which state are you coming from? Pew Pew, I see it's like, are you new in the here? Pew Pew. Let me see Pew Pew. Pew Pew, welcome to the channel. If you have, we talk about medical conditions here, Pew Pew. So, which country are you coming from? Subscribe to the channel. Let's talk about medical issues. So, welcome to the chat, and let's get to know you. If you are a new person, please don't forget to subscribe. You will be getting some notifications when a new video is out or when what does that mean? Pew Pew. Oh, Pew Pew. These are names from Philippines. Pew Pew may be from Philippines or what? I see a picture of a Philippine guy. Okay, let's continue. Now, let's talk about the effects of pushing someone down. You may injure this person. What, Dr. Bed, good evening in Kenya, right? Yes, it is 10 p.m. right now, Saviorman. Welcome to the chat, Saviorman. Welcome to the chat. I was explaining one day about how to place someone on recovery position. Doctor, what is the topic? Oh, it is about epilepsy and several questions that are asked. So I'm answering several questions, like the ones that we have said, epilepsy is a mental illness. You have said no, epilepsy is not a mental illness. It's a neurodevelopment disorder. Mental illness are those that affect how you think, your thoughts, your character, But this one is a problem of neurodevelopment. It is different from the others. Though we are just answering what is epilepsy. Epilepsy is seizures, convulsions, recurrent seizures and convulsions that attack a person when this person has abnormal electric production from the brain. It may be focal or generalized. Focal meaning from a point, specific point, or generalized from both ends of mostly temporal, this side and this side. That is epilepsy. Saviorman, you have never had someone who has epilepsy in your life. You have never seen someone who has epilepsy. Several people have epilepsy. In Kenya, we call it kifafa. Kifafa, I don't know, Saviorman, I don't know how you call epilepsy in your language. It is dangerous. It is dangerous because you have seen Leila Ali has said she lost a friend due to epilepsy. Maybe the convulsions were so hard and they damaged the brain. So you should turn a person down during seizures. Turn them on the side after jacking stops. Time the seizure. If you turn them on the side, always turn them on the left side on the recovery position. What causes that? That one is a neurodevelopment. It is like the one that we were talking about, autism. Someone is born with a brain that jacks abnormal electric signals from the brain. People with epilepsy are less intelligent. That is a question that I've got from. No, cognitive function effect depends on the cause. Seizures frequent and affected brain area. So there are some people who have epilepsy. Cooking with Kemisha is here. What caused that? That one I've answered, Saviorman. Now, there are some people who are born with epilepsy and they are bright. So epilepsy do not determine intelligence. The cognitive effects, the normal thinking capacity, IQ capacity, intelligent quotient capacity, and depends on the cause and the seizures. Doctor, what is Ebola? Ebola is a disease caused by a protozoa that like just cholera. That is a disease that is caused by a protozoa on ingestion, sharing liquids, and so you see. So, Savior Man, we are talking about epilepsy. Let's talk about Ebola one day, and those are it attacks her, and she dropped by her head before she reached the hospital. She was normal. Yes, when you drop your head and hit a stone, you get brain damage, and you know when you are hitting down and you are having brain damage, what happens? The electrical problems in the head will do what? The electrical problems in the head will damage with that. Ebola blood pathogen, yes, it is a blood protozoa that causes a certain thing that is called CAMP not to work well. So you keep on diarrheaing and vomiting. Ebola, same thing as cholera. They lie in the same condition, in the same protozoan condition. So, Savior Man, let's talk about epilepsy because I'm answering questions about epilepsy. We will talk about pathogens of blood and fecal-oral pathogens when time comes. Now, people with epilepsy are not less intelligent. They have normal cognitive function. They can reason well. But the problem comes when you have tonic-clonic seizures, which affect the general brain. You see, if you affect the general brain and it hits from this side and this side, it can affect your cognitive functions if a certain place of your brain is affected. So it's better you take your medicine as needed rather than not taking your medicine, because you reduce the seizures. The more you stay well. The more you stay well. Now, there is a question that I've been asked 15 times. Even here, Savior Man has asked what is Savior Man asked what is epilepsy. Epilepsy presents itself at times with a seizure, but sometimes it does not present itself with a seizure. So someone has asked what is a seizure and how is it related to epilepsy. A seizure happens when the brain cells send abnormal signals suddenly. Then you start to convulse. You see, to convulse. Dr. Ben, Kimesha complaining having headaches all the time. Do you have advice for her? Yes. Kemisha, if you complain having headaches for every time, you go to the hospital, get a full hemogram, and if it is intense headache, do a brain MRI or EEG, both of them, to check where the Barry walking exercise. Welcome to the church. Blessings, Dr. Ben, and everyone in the house. Thumbs up. Thanks, Barry walking exercise. Go to the hospital because headache is a symptom for very many things. It is better you go to hospital and doctor to do a full hemogram. Check the variations of everything, the white blood cells, the red blood cells, the platelets, and then do a radiological exam. You can do an MRI or a CT scan or an EEG. Yes, Kemisha is a good girl. I like her too. She's a good girl. She's always here. She's always working hard. You see, always working hard, Savior Man. She's a very nice girl. So welcome. I see Barry walking exercise. So Kemisha, please, if the headache has been for some time, go to the hospital, do those tests that I've told you, and thank you, Savior Man. I care about you too. Yes. And let's get to know the problem. Sometimes it might be migraines. Migraines have their treatments. Now, I've said seizures are abnormal signals that erupt from your brain, and then you start having jerky episodes or convulsions. Those are seizures. Now, what causes epilepsy? That is a question that Savior Man has asked today. What causes epilepsy? And if you have other questions, please continue asking those questions. Genetics can be there. In a bloodline of some people, you find them having these problems. Head injury. Your head may get an injury, and you hit your injury and your brain suffers, and then you start having these problems. Stroke, we have ischemic stroke, hemorrhagic stroke, a neurogenic stroke. All those can cause the brain to get an injury, and then you start having an epileptic moment, abnormal signals from your brain. Lack of oxygen at birth can injure you. I'm always on every one live stream. Tomorrow I'll be at work, but I know once I get break, I'll send. Thanks, Cooking with Kemisha. Thanks a lot about it. Thanks a lot for supporting everyone and interacting with everyone. Interaction is a good thing. It makes you have a social bank. You have banked on social stature. Many people know you, and when you have a problem, you can call one person or the other. You see, brain tumors, that is called compression, brain injury. Brain tumors can cause you to have epilepsy because they are compressing the brain. Unknown causes. Some people just have epilepsy from unknown causes. You are just having epileptic episode, and if you do the MRI, EEG, all are fine. My live stream is always at 10, but guys, weekdays you come and support me too. Yes, Leila, at 10 I'm always busy, but when I've done, I have to come and see what you have done. Doctor, what are the treatments for that? Now, when it comes for treatment for epilepsy, Savior Man, it depends. If it is brought by an infection, if it is brought by something that can be treated, that one can be treated. If it is a tumor, Nene and Mom, I can see Nene and Mom in the house. Blessings, Nene and Mom. Thanks for coming in. If it is a tumor, if it is an infection bringing high fever, if you treat it, it will be okay. But now, if you have a problem with the neurogenetic that you were born, hey, the Explorer, welcome the Explorer. Hit the like button, Explorer, and share this channel. I see you, the Explorer. Explorer, thanks for coming in. We are talking about epilepsy. So you are like, Explorer, hit the like button. Now, let's talk. Kimisha, nothing, I'll be working. Now, but those ones that are genetic and have no known, Coffee Cakes, welcome Coffee Cakes. Thank you for hitting around. Thank you for hitting. We are answering questions concerning. And Coffee Cakes. Do I have your number? I hope you share me your WhatsApp number so that when I'll be having some time, I can holler at you and we talk. I hope so. On your share with me your WhatsApp number on my inbox, please, of Instagram. So I was answering Savior Man. Savior Man, we can only manage for those people. I can call you even direct. That share your number, I can call you even direct. No worries. You see, those are people you can manage, Savior Man. The drugs we give are the ones that reduce the convulsions, not treatment. But if it is being brought by something that can be managed and it goes away, well and good. The analysis of a doctor will say, but those tests that I'm saying. Can stress trigger Caesars. Yes. I'm reading questions that have been sent in my inbox after that topic. Can stress trigger seizures? Yes. Sleep depression, illnesses, alcohol, and missed medications can trigger seizures in some people. And you know, when your brain is under stress, what happens? You become having so much catecholamines that are being released in your blood. So when the catecholamines are adrenal, some steroids. They are like steroids. So you can have, because a lot of them can damage your brain, and then you start having seizures. So stress can, and you know, stress leads some people to have sleep deprivation, illnesses, alcohol, and missed medications. So it is it. Savior man, coffee cakes, cooking with Kemisha, Betty in the house, all the people that are here, blessings and body walking exercise, blessings and thanks for tuning in and living your life. I usually say everyone who is a new person in the house, everyone who is a new person in the house, always leave your subscription and leave your subscription and like. It is important you interact, and notifications will come your way. Now, can someone die from a seizure? Most seizures stop on their own and are not fatal. Some that are like absent seizures, most of them stop on their own. However, tonic-clonic that are very prolonged or injuries during can be dangerous, and urgent medication may be needed, because long seizures, I've said, they will injure your brain. Long seizures, they will injure your brain. You see, what is a seizure? When is a seizure an emergency? When can I know that this type of seizure needs an emergency occurrence? That is a question that I've been asked 15 times. When can I know that this seizure now, it needs an emergency? We don't need to stay with this person here. We need to call an ambulance so fast. Emergency. Call 991. Emergency. We need to save life. A seizure that lasts for more than 5 minutes. This person is having a seizure. No matter if it is absent seizure or generalized fever. If this person is staring at you for like 5 minutes without waking up, that is an absent fever, and it is atypical. Coming from both sides, call an ambulance or get a car, rush this person to a hospital. Very important. Multiple seizures happening without recovery. Convulsions, having a tonic. Convulsions, losing energy, dropping down, tonic-clonic. For more than 5 minutes, don't stay with that person saying that we know he'll just recover, she'll just recover. Get an ambulance, get a car, rush to a hospital. Breathing problems occur when a person is having a seizure. You start seeing someone do it, like this person cannot breathe. That is an emergency episode. It is the person's first seizure. Every time you see that person has stayed so well, and then you start having a seizure, rush this person to a hospital. First seizures may be telling you something is not good at all, and something must be done. You see, first seizures need to be rushed to hospital so fast. First seizures. Savior man, I'm not talking about seizures. I'm not talking about seizures. They saw when someone is having a seizure, lower him on the floor, turn him on her side, put a pillow under the head. Yes, cooking with Kemisha, that is very important. It is called a recovery position. Always lie that person on the ground, turn this person on the side, on the left side of the hand, put a pillow on the head. It is called recovery position. That is a tick for those people. They know what they are doing. Patent airway, brain relaxation, oxygen gets to the body, and then this person recovers so well. This person recovers so well. Can people with epilepsy drive? Yes, they can drive. But imagine an attack of a person when this person is driving. In many countries, you will find that people can drive if seizures are controlled for required period. But in many countries, it happens to me at work. The patient having a seizure, I have to lower her to the floor. Yes, it's very important. Lower that person to the floor, or if this person is on bed, wait till the seizure subsides, then turn this person on the left side. Don't force when the seizure is happening. Maybe it's a tonic-clonic seizure and you are fighting with this person. No, just wait, relax, make sure that this person is not choking himself or herself. When the seizure is going to subside, turn this person on the left, the recovery position. Let this person now feel relieved. And what you can do when they are too much, you call for help. Get some phenobarbital, get some valproate, get some diazepam, anti-seizures, get some carbamazepine. But mostly in hospitals, what do you give? Phenobarbital, low dose of 8 milligrams, slowly, so that you can not get airway collapse. So that is it, my friends, about the recovery position. Can epilepsy be cured? That is a question that I've been asked so many times. Can epilepsy be cured? What do you think, my guys? Can epilepsy be cured? Can it be cured? What do you think? When I turned her in the recovery position, she was having more seizures back to back. I called 991. Yes, it is important. When you turn this person in a recovery position and is still having it, don't change. Let that person stay in recovery position and call for emergency help. A doctor will come there and will find a line and will give slow phenobarb so that the seizures can be controlled. You see, it is very important to note that when we have said an emergency is more than 4 to 5 minutes, you should not sit with the patient for more than 5 minutes and you have not called for help, or you have not contacted any doctor, or you have not gone with this patient to a hospital. It can lead to fatality or the first seizure. If a person has never had a seizure, please take this person to hospital. Some form can disappear over time, the seizures, the epilepsy, and the sad part, she demise from it. Yeah. Hope it took so long. That a person like that always needs a quick intervention. A quick intervention like a bolus of phenobarb so that the seizures could stop faster. But the more than 5 minutes of tonic-clonic seizures, they injure the brain and the person dies. Some forms can disappear over time, while others require long-term treatment, medicine to take care of the seizures. So those are the questions that have been asked. Now look at this question. Can lack of sleep trigger seizures? Yes. You are working day and night, you are sleeping 30 minutes, you will get seizures because of lack of, the brain is not having time to relax and work on your body. Catecholamines release low melatonin. Melatonin helps the brain to relax and helps the brain to work on the body. So lack of sleep can cause seizures. Yes, if you are watching right now where you are and you are a new person, welcome to the chat. This is Benjamin, the wise guy. Can phone or video games cause epilepsy? No. Most people are unaffected. Whatever that causes these people to have fevers is the long stay without sleep. But you know that if a person who was born with epilepsy, the flashing pattern and lights can trigger, but it cannot cause, it can trigger an episode. If you have had that problem for some time, it can trigger. Can a child inherit epilepsy? That is another question. It's a genetic link. You can inherit, but not all of them. It is not a guarantee that you can inherit because your mother or your father had epilepsy that you can inherit. What should you do during a seizure? Cooking with Kemisha has just answered. Stay calm, protect the head, move harmful object away from this person, turn the person on a side afterwards. Recovery position, time the seizure, very important. Any seizure that goes 3 minutes, 4 minutes, 5 minutes, no, you should not wait. Call for help, and if you are a doctor or a medical practitioner, find a line, get a line, give phenobarbital, 8 milligrams start dose, slow milligrams of 16 until the seizure stops. Yes, valproate, you can use it, slow dose as the seizure goes on to stop, as the seizure goes on to stop. Do not force object on the mouth. Forcefully restrain them from having the jerky moments, the seizure. Don't. You may injure the muscles. The muscles can get a muscle tone because you know it's an electric seizure. You know, give food or water during a seizure. You'll choke this person, he'll get asphyxia, oxygen deprivation. You know, can people with epilepsy play sports? They play. Swimming and climbing may need you may need some supervision too when you are playing some sports. Now, do anti-seizure medicine have side effects? Some of them have side effects. One of the anti-seizure side effects is drowsiness, dizziness, mood changes, and weight changes. Most of the people that take these drugs have more weight. You see that? Doctors balance seizures control with side effects. So we give in milligrams according to how the person is, and there are several. So we choose a specific one for a specific person. That's why I don't like talking about drugs a lot, because this one needs physical intervention with the client so that you can choose the specific one that you need. Can fever cause seizures in children? Yes, they are called febrile seizures. When there is very high temperatures and you are releasing very many prostaglandins, the brain can be injured and then you get some fevers. These are different forms from chronic epilepsy. This is not an epilepsy. It is a seizure, an attack because of some problem that has occurred. You see, it is not a seizure. Now, let's talk about something that we call can epilepsy, the memory. Dr. Ben, when a person has seizures and also a DNR, order its kind. Yes, it's tricky, but you know, everyone has got a presentation. And as I say, all seizures are different types, and we have different types of epilepsy. So you treat according to, and that's why I don't like talking about treatment. If you check most of my videos, I advise, but when it comes to specific treatment with drugs, I avoid. You see, I avoid that. This is left for doctors only, like electric defibrillations, jerky moments, intubation for resuscitation. This is where the doctors are needed, not anyone. You get? not anyone. So that's why I'm saying when it comes to do not resuscitate, we check at some things. We check at some things, and you weigh out. It is tricky, as you say, but let that be left to the ethics of the doctor personally. Yes, there are some ethics when you are doctor's ethics when you are working and practicing, and some people, even if they have signed a do not recover, the DNR, when this person has signed a DNR, there are sometimes we end up resuscitating, and the person had signed. You get, so it is tricky, and that one is left at a personal level. So we don't just say do not resuscitate. Do not resuscitate because that person had signed. There are some instances you resuscitate. Sometimes seizures can affect memory. That was the question. And can alcohol trigger seizures? Always. Alcohol withdrawals can cause seizures. Mixed alcohol with seizures medication is a bad thing. You'll get more seizures. Can someone feel a seizure coming? Deja vu, smelling, sudden. If a DNR is in a place, if the person has to stop in breathing, you can't do CPR. I've told you, cooking with Misha, the doctor's training and the oath we take. There are sometimes there are some situations. There are some situations. I don't want to talk about that cooking with Kemisha here. Let me not talk about that here. Yes, let me not talk about that, because the oath we take, there are some things that we can do, and there are some things we cannot do. So when it comes to matters concerning ethics, I don't like going deep into them, because the oaths we take, they guide us on how to manage some patients legally, even if it will look wrong in the eyes of the people. So let me not go down to that so much. Now, now we are at the last part. Can someone feel a seizure coming? Yes, you can feel a seizure coming. That is always given. You can feel a seizure coming at times. You call them deja vu, tickling sensation, sudden fear, visual challenges, and smell. So that is it for today. I've answered some of the questions that were here. Several questions that were asked today. Hope I've tried to answer those questions. Is anyone else having a question that can ask here? Let me 5 minutes for the question. You know, here it is 10:30 p.m. My time to go home is just away. Anyone have any question? Anyone has any question? So anyone has any question? If you have any question, you can ask. I'm checking on some of the questions that have been asked by several people here, and some I can't ask. I can't answer. Some of them I cannot answer at all. So guys, that was it. Have a lovely evening. We will meet tomorrow, but there is a premiere coming at night. If you have time, anyone can watch. Thanks a lot, Leila. Welcome. Let's meet tomorrow we continue with focal, tonic-clonic seizures and epilepsy. So everyone, be blessed, everyone, and stay calm where you are. Bye bye. See you tomorrow.